People a lot of times ask us, how do we comfort people with mental health issues or even addiction? And it's such a tough question. And it's interesting because a lot of people that call our office, they want it to be mental health. They want it to be a mental disorder. Not that they want it to be anything, but if they had to choose between addiction and mental health, they would want it to be mental health. And again, in counseling families, why? Mental health disorders is easier for them to digest. It gives them the ability to enable and be codependent. They see somebody with a mental disorder as more of a victim than they would somebody with addiction. Families see both as a victim often, but they more so see it with mental illness. So, how to comfort somebody, there still has to be some level of accountability. There still has to be some level of boundary, because regardless of what the problem is, they have to be held accountable. There has to be a reason for them to address the problem. So if you're codependently comforting them and they're still treating you disrespectfully, or they're just not changing or advocating for their own care, you have to look how to shift your behaviors so that you can be empathetic, but also send the message that it's not okay the way that you're being treated. So it's a fine line between holding somebody accountable for their actions and their behaviors, whether it be substance use or mental disorder, and, not letting them run through your life like a tornado. So when it comes to comforting, it's a fine line, and you have to learn what the difference is. And that's part of our curriculum in the Safe Family Intervention Recovery Program, and learning how to effectively communicate so that they can actually address the problems that they have without holding you hostage for what's going on with them. And that's the biggest thing that I'd want you to understand is, why do you feel the need to comfort them? And is that comfort getting you ahead? Is it helping them, or is it not? And we have to discuss strategies and protocols so that we can help them without hurting them, but at the same time protecting you so that you don't continue to live in this lifestyle choice that they choose to continue in without addressing the problem.